Hi, I'm Dr. Lucy Harris from Mayo Clinic in Scottsdale, Arizona, and my topic to talk to you about today is actually bloating. So I think the 5-minute take on this subject would be to realize that bloating can come from different areas in the body, and asking the patient where they're experiencing bloating is an important first question. How I would divide up bloating would be there's the patient that has gastric bloating. This usually starts immediately after a meal and can be associated with a variety of conditions such as dyspepsia and gastroparesis. There's what I call the small bowel bloater, and this is the patient that also comes in. Their symptoms start greater than 30 minutes after, or maybe come several hours after eating. And this can be associated with things like celiac disease, intestinal dysmotility, and perhaps small intestinal bacterial overgrowth. And then the final sort of area of bloating would be the colonic bloater who comes in with complaints of what you might think of as irritable bowel syndrome with constipation, slow transit constipation, or constipation. And in this group, you also want to keep in mind the whole area of pelvic floor dysfunction as well. I think an overall important concept to realize in terms of the gastric bloater is the concept of gastroparesis. Gastroparesis we think of as something occurring primarily in the diabetic population, but really over a third of it is idiopathic, and it also is associated with a variety of medical neurological conditions, particularly things like Parkinson's disease and multiple sclerosis. And now there's an increasing awareness of postural orthostatic tachycardic syndrome and autonomic disorders. So perhaps a third of our idiopathic patients may be in one of those categories as well.